My name is Laurie Anderson, and I came to Extivita for post-COVID treatment. Right before COVID, I was very busy at work. I'm a medical writer and a safety scientist for a pharmaceutical company. So I got diagnosed with COVID, and I had been vaccinated and boosted, so I was anticipating like a bad cold or maybe a mild flu. And for the first 8 to 10 days, it was that. I had low-grade fever and cough and didn't feel good, but then after about 8 to 10 days, I got worse. I'm an avid gardener. We have a lot of flower beds and vegetable gardens in our yard, and I really started to think that this just wasn't going to be a gardening year for me because I was too tired. I couldn't do my normal gardening preparation during that time. And my doctor thinks I might have had actually the Delta variant. My taste and smell was completely gone, and it was scary. I started to be very concerned. I went on medical leave for my job, which was daunting because I wasn't getting better and I didn't know where this was going to lead. I was nervous. I was very nervous. My naturopath had recommended NAD infusions to me to help with COVID. And so I actually Googled, where do I get an NAD infusion here locally? And Extivita was the first that popped up. And Elena mentioned, you should really consider HBOT because we're seeing really good results for patients with post-COVID. And at first I said absolutely not because I'm incredibly claustrophobic. The staff at Extivita were very allowing and very understanding of this. And I was determined to get to the other side of the claustrophobia and get the treatment. And they seemed to be willing to walk with me for that, which was wonderful because otherwise I probably wouldn't have finished. I felt like every time I left the HBOT, it felt like I was doing right by my body. There was something about that surge of oxygen under that pressure that when I would walk out, I'd be like, this feels so good. My body just feels good. It's almost like I could feel it getting stronger with every session. And I had talked to so many people who 6, 8, 10, 12 months later still were having trouble being able to taste or smell. And I couldn't believe that in essentially a 7-day time frame, I was getting my taste and smell back. I was blown away. I couldn't believe that the results I was seeing based on how sick I became. I think it's really important for people to understand that HBOT's been around for a long, long time, but only if you have a diabetic foot ulcer or the bends or things like that you go to a hospital setting for and you pay $4 grand. And your insurance has to cover it. But this is here. It's here. It's affordable. It can be transformational. I think it can be transformational. It has been transformational for me. But I just don't know how many people know that it's here as an option. I think more people are learning about it, but just the understanding that it's been around for a long, long time. This is not a new therapy. It's just now available to us. I do have restless leg syndrome sometimes at night, and I noticed while I was doing the HBOT that actually decreased, and I was sleeping heavily through the night, every night. And this was so serendipitous that Extivita just kind of fell in my lap, and I found myself here, and then it was this amazing journey of healing. I would absolutely recommend it to anybody that has an inflammatory condition. Even if it's not inflammatory, it's worth exploring and can really be life-changing.